my practice in dry therapy is across the board. We do everything from looking at just tear deficiency, for which we use certain drops. We look at meibomian gland dysfunction. We look at things like eyelid dysfunction. And really, when you talk about dry eye therapy, it is really a multifactorial disease. And you really can't treat it just with one technique. And that's one of the keys to understanding how to treat dry eye therapy. However, it turns out that meibomian gland dysfunction is really incredibly prevalent. And I would say the majority of my patients who have dry eye therapy or dry eyes actually have meibomian gland dysfunction. In my practice, we have a combination of different ways to treat that. I always treat patients with pharmacologic agents, meaning whether it's an omega-3 or if it's an initial treatment with azithromycin or doxy. But one of the mainstays of my treatment is heat. I use an in-office heating treatment called MiboFlow. MiboFlow is a phenomenal treatment that melts the glands at just the right temperature. However, that's an in-office treatment. What you really need, and to make this completely successful, is you really have to have something that you do after the patient leaves the office and at home. I have tried so many different techniques. I've tried beads, I've tried rice, sock, I've tried hard-boiled eggs, we've tried tea bags, I mean the whole gamut. And they're used to a certain extent successfully for some people. Until I found out about iGene. Now, I love to call it iGenie because I do think it's a really great product. It's a great device because it has little inserts that heat up to about 109.4 degrees, and that is actually a very appropriate temperature of melting the meibum in your eyelids. What's great about this is that it doesn't require microwaving, it doesn't require a lot of the hassle associated with rice or with tea bags or with boiled eggs, and you can take it on an airplane, you can use it at the office. And remember, the most important thing about meibomian gland dysfunction, it's a lot like dentistry and brushing your teeth. You have to brush your teeth every day, and so it's important to tell them to use that, and it's important for the patient to use it at least once a day. If I can get them to use it twice a day, that's even better. Occasionally, if they're on an airplane flight or they're really busy or in the middle of the day, some of my patients have very dry eyes as they've been on the computer screen all day. And so occasionally it's nice to have them be able to use it at the office, and they'll use it in their own environment. And I ask them again to use it like midday or something for about 10 minutes as well. And that's actually been really helpful for some of my patients. After they've used the iGene at home, the other thing that has to happen is there has to be some encouragement, because you can do an in-office treatment, which is great. You can get them to use it at home, but you really need to keep encouraging the patients to continue to use their warm compresses. So as a physician, one of the neat things that you can observe is what works and what doesn't work in your practice. And as I've seen in my practice, we've tried a lot of different products to see what is going to be great for them and what's great for the patient. What I've found is, as I said, I've tried a whole bunch of different dry eye overnight masks. And the reason why I'm excited about iGene is because it's the only thing that the patients have actually used often. They will come back. Now, there is a refill that they have to buy, and there is a cost to that. And so that's one of the disadvantages of iGene, is that you have to buy these refills. But apparently the benefit outweighs that cost, at least in my practice. And the nice thing is that I see that because I constantly are getting requests for refills and to be using it. And so that to me is one of the strongest recommendations for a product that works. If it didn't work, people, even in Palo Alto, will not pay for something that's, that they don't think is going to have a big benefit for them. From a financial standpoint, it's not a huge moneymaker for your practice. However, you do sell it for a small, modest profit, and it pays for itself, so it's not bringing down your practice. It's not a detriment to your workflow. So that's what's nice about the product. But I do really believe in it because, I believe in it more fundamentally as a product that works for the fundamental disease of meibomian gland dysfunction in terms of the constant heating. So iGenie is a wonderful device that allows you to have the patient stay on top of their dry eye disease and essentially give them the ability to maintain a good flow through their meibomian glands.